It's a part of life that changes as we get older, isn't it? Something deeply personal, something many men have always done, but maybe don't talk about much. And as the body changes, as we reach our 60s and beyond, our relationship with this private aspect of ourselves can change too. Sometimes, the ways we've always done things might not be the best way anymore. There's often a silence around this topic, maybe a little embarrassment or just a lack of information. And in that silence, some things can happen that, while seemingly small on their own, can quietly start to cause discomfort or even lead to bigger issues down the road. It's a painful reality that we don't get a user manual for aging, especially when it comes to these intimate details. But ignoring these changes or continuing old habits without adapting can silently harm our comfort, our health, and even our peace of mind. There are certain mistakes that doctors see, things that pop up in conversations about men's health later in life, that are often linked back to practices that haven't been updated for the aging body. These aren't things anyone talks about at the pub, but they are important for maintaining your well-being. In this video, we're going to look at some common mistakes many men over 60 might unknowingly be making when it comes to this private part of life, and how avoiding them can help you maintain your health, comfort, and overall well-being. These aren't just theoretical points. They're practical things that can make a real difference in preventing irritation, discomfort, and potential complications, helping you feel better and more confident. Understanding these points is about self-care and listening to your body as it matures. Stick around and watch to the end, because we'll cover things that might genuinely surprise you and give you practical ways to avoid these silent harms. Let's start with the first point, and it's a really crucial one, especially as you get older. Ignoring changes in sensation or function. You know, when you're younger, the body is pretty resilient. You might feel something a bit off one day, and it's fine the next. But as we get into our 60s and beyond, the messages our bodies send us become more important, and sometimes they're trying to tell us something significant. Masturbation can be a time when you're paying close attention to your body, and it can reveal things you might not notice otherwise. Are there new pains? Maybe a dull ache or a sharp twinge during or after? Has the sensation changed? Is there discomfort? Is achieving or maintaining an erection different? Is ejaculation painful? Or is the volume or consistency noticeably changed? These aren't just random occurrences to be brushed aside. Ignoring these kinds of changes, thinking they're just a normal part of aging or something to power through, is a mistake, a big one. Think about it like your car engine making a funny noise. You wouldn't just turn up the radio and hope it goes away, would you? Well, your body deserves the same attention. Changes in sensation or function during something like masturbation could be indicators of underlying health issues that need attention. For men over 60, this is particularly relevant regarding prostate health. Issues like benign prostatic hyperplasia, or BPH, which is a non-cancerous enlargement of the prostate, are very common. Symptoms can include difficulty urinating, a weak stream, or needing to go frequently. Sometimes prostate issues can also cause discomfort or pain in the pelvic area, which might become noticeable or exacerbated during sexual activity, including masturbation. Ignoring this discomfort could mean delaying diagnosis and treatment for something manageable, but which could worsen if left unchecked. It's not just the prostate. Changes in erectile function noticed during masturbation could point to circulatory issues, hormonal imbalances, or even be an early warning sign for conditions like heart disease or diabetes, as blood flow is crucial for erections. Pain could indicate infection, inflammation, or other structural issues. Ejaculatory pain or changes could signal problems with the seminal vesicles or prostate. The mistake isn't experiencing the change, it's ignoring the signal. By paying attention to your body during these private moments, you have a unique opportunity to catch potential health issues early. If you notice persistent pain, discomfort, or significant changes in function or sensation that weren't there before, it's a sign to talk to a doctor. Don't feel embarrassed. Doctors deal with men's health issues all the time, and these symptoms are important pieces of information for them. Ignoring them allows potential problems to fester silently, potentially becoming harder to treat later. So, the first crucial point is, listen to your body. Pay attention to any new or changing sensations or functions during masturbation, and don't hesitate to discuss them with your doctor. It's an act of self-care that can truly prevent silent harm. Now, moving on to another point that's often overlooked, and it relates directly to physical comfort, using excessive friction or not enough lubrication. As we age, our skin changes. It tends to become thinner, drier, and less elastic. This is true for skin all over the body, including the skin of the penis. What might have been perfectly fine in your younger years, maybe just using natural moisture or minimal lubrication, can become problematic after 60. Without adequate lubrication, friction increases dramatically. This isn't just about comfort in the moment. It can lead to irritation, redness, chafing, and even small micro tears in the skin. These tiny breaks in the skin barrier can not only be uncomfortable but also make you more susceptible to minor infections or skin conditions. Think about rubbing your hands together very quickly without any lotion. The skin gets warm, maybe a little red, and after a while it can feel raw and sore. It's a similar principle but in a much more sensitive area. The repetitive motion of masturbation without sufficient glide can cause unnecessary wear and tear on the skin and underlying tissues. This is especially true if you're using materials or techniques that create a lot of friction, like dry hands or rough fabrics. The silent harm here is chronic irritation or minor injury that might not seem like a big deal at the time, but can lead to persistent soreness, sensitivity, or make other issues, like skin dryness, even worse. The solution is simple, readily available, and makes the experience much more comfortable. Use lubrication, and be generous with it. There are many types of lubricants available: water-based, silicone-based, and oil-based. For this purpose, water-based or silicone-based lubricants are generally recommended as they are less likely to irritate sensitive skin and are compatible with most materials. Oil-based lubricants can degrade certain materials and may be harder to wash off, potentially trapping bacteria. Using a good quality lubricant reduces friction significantly, allowing for smoother movement and preventing skin damage. It makes the experience more comfortable and less likely to cause irritation or soreness afterwards. Don't see using lube as a sign of weakness or something only needed if there's a problem. See it as smart self-care, adapting your practice to the natural changes in your body to ensure comfort and prevent silent harm. Just a little bit of effort here can save you a lot of discomfort later. All right, let's talk about a third point that ties into the body's recovery process: overdoing it, either in frequency or intensity, and not allowing your body enough time to recover. While masturbation is generally a healthy and normal activity, and there's no universally prescribed limit, the body's ability to bounce back changes with age. When you're younger, you might be able to engage in strenuous physical activity or repetitive motions and recover very quickly. Muscles repair, tissues heal, and any minor stress disappears rapidly. But as we get older, recovery times lengthen. This applies not just to lifting weights or going for a run, but also to the tissues involved in masturbation. Engaging in masturbation too frequently without giving the tissues time to rest and repair can lead to persistent soreness, tenderness, or irritation. If the intensity is very high, involving vigorous or rough movements, the potential for minor tissue stress or bruising is also higher, and recovery from that takes longer than it would have in your youth. The silent harm here is chronic low-level inflammation or tissue fatigue that never quite gets a chance to fully heal because it's being stressed again too soon. This isn't usually a serious medical emergency, but it can be a persistent source of discomfort and make the experience less pleasurable or even slightly painful over time. It can also make the area more sensitive and prone to irritation from other things, like clothing. Listen to your body's cues. If you experience soreness, tenderness, or a feeling of being raw after masturbating, that's a signal that you might have overdone it, either in terms of frequency or intensity, or maybe a combination of both, especially if you weren't using enough lubrication as we just discussed. It's your body telling you it needs a break to recover. Ignoring these signals and pushing through can perpetuate the cycle of irritation, finding a rhythm that works for your body. Now, at this stage of life is key. It might mean adjusting how often you do it, or consciously reducing the intensity of the movements. It's not about stopping or cutting back drastically unless that's what feels right for you. It's about finding a balance that allows for comfort and recovery. This simple adjustment to frequency or intensity, guided by how your body feels afterwards, can prevent a lot of silent discomfort and keep the experience a positive one. Paying attention to these signals is just another way of being kind to your body as it ages gracefully. Now let's continue our conversation about these often unspoken aspects of men's health after 60. We've talked about listening to your body's signals, the importance of lubrication to protect aging skin, and finding a frequency and intensity that allows for proper recovery. Building on these points, another potential mistake, and one that's perhaps the simplest to address yet sometimes overlooked, is basic hygiene. You know, it sounds obvious, doesn't it? But good hygiene practices, particularly before and after masturbation, become increasingly important as we age, because our immune systems might not be as robust as they once were, making us potentially more susceptible to infections. The skin can also be more delicate, and minor irritations can sometimes lead to more significant issues if not kept clean. Engaging in this activity with unclean hands or not cleaning the genital area afterwards can introduce bacteria. While the body is generally good at protecting itself, introducing bacteria into the urethra or onto irritated skin can potentially lead to infections. For men, this could include urinary tract infections, though less common than in women, or skin infections. If you are uncircumcised, paying extra attention to cleaning beneath the foreskin is particularly important, as moisture and smegma can build up there, providing a breeding ground for bacteria. The silent harm here is the increased risk of uncomfortable, potentially painful infections that could easily be avoided with a little care. A urinary tract infection, for example, can cause burning during urination, frequent urges to go, and general discomfort, and can sometimes lead to more serious kidney infections if not treated promptly. The fix is straightforward. Wash your hands thoroughly with soap and water before and after. A quick wash of the genital area afterwards is also a good practice. This simple habit significantly reduces the risk of introducing harmful bacteria and keeps the area clean and healthy. It's a small step that makes a big difference in preventing silent harm and maintaining your comfort and well-being. It's about respecting your body and keeping things clean to avoid unnecessary problems down the line. Let's move on to another point that can be particularly insidious because it involves ignoring potential underlying health issues. This is using masturbation, sometimes unknowingly, as a way to mask symptoms or cope with discomfort that should really be evaluated by a doctor. We touched on ignoring changes earlier, but this is slightly different. This is about actively experiencing a symptom, maybe discomfort, pain, or a significant change, and then continuing or even increasing masturbation in a way that might temporarily alleviate the symptom or just distract from it, rather than seeking medical advice to understand the cause. For example, some men experiencing prostate discomfort or pain might find that ejaculation temporarily relieves pressure. If they then rely on masturbation for this temporary relief, instead of seeing a doctor about the underlying prostate issue, they are masking a symptom and allowing the potential problem to continue unchecked. This is where the silent harm can be significant. Conditions like prostate enlargement, prostatitis, inflammation of the prostate, or even less common but more serious issues can present with symptoms like pelvic pain, discomfort, or changes in urinary or ejaculatory function. Relying on a temporary coping mechanism like masturbation to get by, instead of getting a diagnosis, means you are delaying potentially crucial treatment. What could be a simple infection or inflammation that's easily treated with medication might, if ignored, lead to chronic issues or make treatment more complicated. It's like having a toothache and just taking painkillers every few hours instead of going to the dentist. The pain might lessen for a bit, but the cavity is still getting bigger. The mistake here isn't the masturbation itself, but using it as a substitute for necessary medical evaluation. If you are experiencing persistent pain, significant discomfort, or worrying changes during or after masturbation, or at any other time, see your doctor. Be open and honest about what you're experiencing. These symptoms are often important clues for diagnosing conditions that are common and manageable in men over 60. Ignoring them allows the underlying issue to continue its silent harm, potentially impacting your long-term health and quality of life. It takes courage to discuss these things, but it is absolutely the right thing to do for your health. Another silent harm, and this one delves a little deeper into the emotional and psychological side of things, is when masturbation is accompanied by or leads to feelings of guilt, shame, or becomes a compulsive behavior used purely to escape difficult emotions or situations. Sexuality, including masturbation, is a natural part of human experience throughout life. However, societal attitudes, past conditioning, or personal beliefs can sometimes attach negative feelings to it. For men over 60, who may be dealing with changing relationships, loss of a partner, health issues, or feelings of isolation, masturbation can become a complex area. If it's something you do and feel okay about, that's one thing. But if you find yourself feeling significant guilt or shame afterwards, or if it's the only way you cope with stress, loneliness, or anxiety, becoming something you feel you have to do rather than something you choose, then it can be silently harming your emotional well-being. This isn't about the act itself being wrong. It's about the relationship you have with it and the feelings it generates. Persistent guilt or shame can erode self-esteem and contribute to feelings of depression or anxiety. Using it compulsively as a sole coping mechanism means you're not addressing the root causes of your stress, loneliness, or other difficult emotions. It can become a form of avoidance that prevents you from seeking healthier ways to cope, connecting with others, or addressing underlying psychological needs. A doctor might warn about this not because the physical act is harmful, but because the associated psychological distress is detrimental to overall health and quality of life. Mental and emotional health are just as important as physical health, especially as we age. If you find that masturbation is consistently leaving you with negative feelings, or if it feels like something you can't control and are using to escape, it's a sign that something might need attention, perhaps from a therapist or counselor. Discussing these feelings with a trusted professional, whether it's your doctor initially or a mental health expert, can help you understand where these feelings are coming from and develop healthier coping strategies. It's not about judgment. It's about ensuring this aspect of your life contributes positively to your well-being, or at least doesn't cause silent emotional harm. Releasing shame and addressing underlying issues is a powerful step towards living a happier, more integrated life. And finally, let's consider a point that's perhaps more practical but still relates to preventing discomfort and injury: not adapting your technique to your physical limitations or changes in mobility. As we get older, things like joint flexibility, muscle strength, and overall physical stamina can change. What might have been an easy or comfortable position or technique decades ago might now put a strain on your back, hips, knees, or shoulders. Trying to force your body into awkward or uncomfortable positions, or using techniques that require more physical effort than is comfortable, can lead to muscle strain, joint pain, or other minor injuries. While maybe not a direct medical mistake in the traditional sense, it's a practice that can lead to silent physical harm in the form of chronic aches and pains, or even acute injury if you lose balance or strain something severely. Think about everyday activities. You adapt how you bend down to pick something up or how you reach for something on a high shelf as your body changes. The same principle applies here. If your hips are stiff, getting into certain positions might cause pain. If your shoulder has limited mobility, certain arm movements might be uncomfortable. Ignoring these physical limitations and trying to perform the activity in a way that causes strain is unnecessary and can be harmful over time. The silent harm is the accumulation of minor strains and stresses on your musculoskeletal system, leading to persistent discomfort or increasing the risk of injury during the activity, or even afterwards when you're doing something else because the area is already strained. The key is simple: listen to your body's physical comfort signals. If a position or technique feels awkward, causes strain, or leads to discomfort during or afterwards, adjust it. Experiment with different positions that are more comfortable for your body's current capabilities. Pay attention to how your joints and muscles feel. Using pillows for support, finding a stable and comfortable surface, and choosing positions that don't require excessive flexibility or strain are all practical ways to adapt. It's about making the experience physically comfortable and safe, ensuring that it doesn't inadvertently contribute to aches, pains, or injuries. Adapting your technique is an act of self-respect and physical intelligence, preventing silent physical harm and ensuring you can continue this aspect of your life in comfort for as long as you desire. So, we've covered quite a few important points today, things that a doctor might gently bring up or wish men over 60 were more aware of regarding this very personal part of life. We've talked about the absolute importance of paying attention to your body's signals, any new pain, discomfort, or changes in function or sensation. These aren't just random occurrences. They can be clues your body is giving you about underlying health issues that need attention, not just to be ignored or pushed through. We also discussed the simple yet critical need for adequate lubrication to protect aging skin from irritation and micro tears. ensuring comfort and preventing unnecessary soreness. We explored finding a healthy rhythm, understanding that your body's recovery time is different now, and that overdoing it in frequency or intensity without allowing rest can lead to silent chronic irritation. We also touched on the foundational importance of good hygiene practices to prevent infections, a simple step that safeguards your health. We looked at the significant harm that can come from using masturbation to mask or cope with symptoms that should be medically evaluated, stressing the need to see a doctor if you're experiencing persistent pain or worrying changes. And we considered the emotional well-being aspect, recognizing that guilt, shame, or using it compulsively can be forms of silent psychological harm that deserve attention and support. Finally, we covered the practical need to adapt your technique to suit your body's current physical capabilities, preventing strain and injury by simply listening to what feels comfortable and safe. Remember, getting older is a process of adaptation and self-awareness. It's not about things stopping or becoming impossible. It's about doing them in a way that honors your body and supports your health and well-being at every stage. These points aren't meant to cause worry, but rather to empower you with information so you can make informed choices about your self-care. Small changes in awareness and practice really can make a big difference to your comfort, your health, and your happiness as you continue living your best life. This is a topic that's not often discussed openly, but it's important. Your experiences and thoughts might be helpful to others. So please feel free to share any thoughts, experiences, or questions you have in the comments below. Let's create a space where we can learn from each other. If you found this video helpful, or if it gave you something to think about, please give it a like. It really helps us know what kind of content is useful to you and helps the video reach more people who might benefit from this information. And if you haven't already, consider subscribing to the channel. We share helpful content focused on helping you navigate this stage of life with health, confidence, and well-being. Thank you for watching and for taking the time to prioritize your health. Keep listening to your body, keep learning, and live your best life at every age.